Preventing cervical cancer involves a combination of vaccination, regular screenings, and lifestyle choices. The primary cause of cervical cancer is persistent infection with high-risk types of human papillomavirus, HPV. Here are key strategies for preventing cervical cancer. HPV vaccination. Target population. HPV vaccination is recommended for both males and females. It is typically administered in early adolescence, around ages 11 to 12, but can be given as early as age 9 and up to age 26 for females and age 21 for males. Vaccine types. The HPV vaccine protects against the most common high-risk types, especially HPV 16 and HPV 18, which are responsible for the majority of cervical cancer cases. The vaccine also protects against other HPV types that can cause genital warts. Doses. The vaccine is usually administered in a series of 2 or 3 doses, depending on the age at the first dose. Screening tests. Pap smear, Pap test. Regular Pap smears, or Pap tests, are essential for early detection of abnormal cervical cells. During a Pap smear, cells from the cervix are collected and examined for any signs of precancerous or cancerous changes. HPV testing. HPV testing can be done alone or in conjunction with a Pap smear. It identifies the presence of high-risk HPV types, allowing for early detection of infection and monitoring of cervical health. Regular checkups. Gynecological exams. Routine gynecological exams, including pelvic exams, provide an opportunity for healthcare professionals to assess the overall health of the cervix and detect any abnormalities. Safe sexual practices. Condom use. Consistent and correct use of condoms can reduce the risk of HPV transmission but does not eliminate it entirely. Limiting sexual partners. Having fewer sexual partners and choosing partners who have had few or no prior sexual partners can reduce the risk of HPV exposure. Quit smoking. Smoking has been associated with an increased risk of cervical cancer. Quitting smoking can contribute to overall health and decrease the risk of cervical cancer. HPV education. Increasing awareness about HPV, its transmission, and the importance of vaccination and screenings can empower individuals to take proactive steps for their cervical health. Early detection and treatment of precancerous lesions. Treating precancerous lesions identified during screenings can prevent the progression to invasive cervical cancer. Vaccination and screening in older age. Vaccination and screening may still be beneficial for individuals beyond the recommended age groups, depending on individual health factors and previous vaccination or screening history. It's important for individuals to discuss their risk factors, vaccination status, and screening schedules with their healthcare providers to create a personalized plan for cervical cancer prevention. Regular and proactive healthcare, combined with lifestyle choices and vaccination, can significantly reduce the incidence and impact of cervical cancer.